Thallium, an inorganic metallic irritants. Toxic compounds: thallium acetate, thallium sulfate. Action: thallium and its salt are corrosive to the GIT. Mechanism: action: after absorption, it replaces potassium in numerous potassium-dependent enzyme systems. Thallium damages the ribosomes, resulting in impaired protein synthesis. This results in failure of aerobic respiration and cellular energy production. In the peripheral nervous system, thallium causes a dying back or Valerian degenerative sensory neuropathy due to acute myelin fragmentation and axonal degeneration. Motor neuropathy may occur since it impairs depolarization of muscle fibers. Hair loss is caused by stunned mitosis of hair follicle epithelial cells and by destruction of hair shaft cells. Absorption and excretion: thallium is absorbed through the skin and mucous membrane of the GIT and respiratory tract. It is a cumulative poison and deposited in the epidermis, liver, kidneys, muscles, hairs, and bones. Excretion is through the kidneys and it is also excreted through the milk. Signs and symptoms: acute poisoning. In acute poisoning, signs and symptoms start between 12 to 36 hours to 12 days. Okay, GIT symptoms and signs: irritation, metallic taste in mouth, nausea, vomiting, hematemesis, abdominal pain, anorexia, dryness of mouth, colic, diarrhea, or constipation. Respiratory system signs and symptoms: distress, running nose, respiratory depression. Ocular signs and symptoms: conjunctivitis, scotoma, blindness. Muscular signs and symptoms: polyneuritis, tingling and pain sensation in hands and feet. Pins and needles, like pain. Okay. Glove stalking, numbness, muscular weakness with paralysis of some muscles. Peripheral neuropathy. There is peripheral neuropathy. Okay. Tremors. CNS signs and symptoms: central nervous system signs and system. There is confusion, nystagmus, insomnia, psychosis, ataxia, organic brain syndrome, coma, dysfunction of cranial nerve, second, third, fourth, and sixth, which govern oculomotor and visual functions, are most common. Other signs and symptoms: loss of scalp hair, eyebrows, body and axillary hair, delay features, axillary hair that is delayed feature, okay, and deafness. In subacute cases, there is encephalopathy with white strips across the nails, that is called Mesh lines. In chronic exposure, the cardinal features are gastroenteritis, peripheral neuropathy, and alopecia. Asymmetrical mixed peripheral neuropathy is characteristic, with distal nerve more strongly affected than proximal nerves. Causes of death usually are related to the central nervous system, cardiac, and renal system effects. No fatal dose. In adult, it is 200 mg to 1 gram. Okay, more than 8 mg per kg. In children, 8 milligram per kg body weight. Now fatal period is variable but usually 24 to 36 hours. Laboratory investigations. Thallium toxicity can be monitored in blood, urine and hair. Eosinophilia is a common phenomenon. Okay, DC test can be done. Thallium more than 40 microgram percent in blood and more than 50 microgram per liter in urine. Levels up to 20 microgram per liter is considered normal. In hair, thallium levels less than 50 nanogram per gram of hair are considered normal. Okay. Urine may be clean with proteinuria, diminished creatinine clearance, elevated blood urea nitrogen. Diagnosis: GIT and polyneuritic symptoms together with the falling of hair from head, eyebrows and axilla should lead to suspicion of thallium poisoning. A brownish black pigmentation close to the hair root is characteristic of thallium exposure and may appear as early as third to fourth day. Opacity in the liver on X-rays okay has been reported. Okay. Now treatment. Patients should be kept warm. MS is indicated within 4 to 6 hour injection. Multiple dose of activated charcoal may be given, followed by saline purgatives. Stomach wash with 1% sodium or potassium iodide solution, Prussian blue or Berlin blue in a dose of 250 mg per kg per day in 2 to 4 divided doses orally. Okay, so Prussian blue acts to sequester the ions in the intestine and preventing their absorption. Sodium dithiocarbamate 25 mg per kg body weight in 500 ml of 5% glucose IV once daily may be given. Pilocarpine may be given. Potassium chloride promotes renal excretion of the thallium. Administration of sodium polystyrene sulfate as sodium. Thallium okay. Thallium exchange resin may be helpful. Hemodialysis, peritoneal dialysis may be useful within 48 hours of ingestion. Now talk about postmortem findings. There is loss of air, stomach mucous membrane may be inflamed and there may be submucous petechial hemorrhages. Spleen are congested, liver congested and so centrilobular necrosis and fatty degeneration. Kidneys are congested, glomeruli are swollen, convoluted, tubules show cloudy swelling and necrosis of the cells. Trachea and bronchi are congested, lung congested with subpleural hemorrhage, heart, fatty degeneration. Brain, there is meningeal vessels, the meningeal vessels may be congested. Cells of adrenal cortex, thyroid and hair follicles show vacuolization and degenerative changes. Now medical legal aspects. Poisoning by thallium is rare. Okay, it was used as an ideal homicidal poisoning in some European countries and Australia. Suicidal cases are also seen sometimes. Now talking about some facts. Okay. Thallium stress test. In clinical practice, thallium 201 is used as a radioactive tracer in heart scintigraphy to detect myocardial ischemia. Thallium may be detected in urine 1 hour after ingestion. Normal level less than 0.003 micromole per liter. A level of more than 0.98 micromole per liter is toxic. Microscopic examination of hair after application of 10% sodium hydroxide may reveal dark bands of pigmented material. characteristic of presence of thallium. Thank you.